Hi everyone, my name's Ed Garrett. I'm the Chief Executive of the Ipswich and East Suffolk Clinical Commissioning Group and the West Suffolk Clinical Commissioning Group, and it's a great pleasure to invite you to this community event this evening to talk about the rollout of the Covid-19 vaccination programme, which is so important to all of us. I'm going to talk through some slides just to set out a brief introduction to the subject. And then I've got a panel of esteemed colleagues with me who are really keen to help answer any questions that you've got. So firstly, the vaccination programme is really a huge collaborative effort. It's all about teamwork. So NHS organisations, NHS clinicians, NHS staff have been working with local councils, voluntary community sector organisations and the public to get the programme up and going. It's been a massive effort, and indeed it's the largest vaccination programme in the history of the NHS, and we're doing this at a very, very busy time given the COVID pandemic and the pressures that's putting on all of our services. We started rolling out the vaccination programme in December, and we largely had the Pfizer vaccine there, and we were using that in our hospitals and in a small number of primary care sites. And we now have access to more of the Oxford, the AstraZeneca vaccine, which is easier to transport and enables us to be more flexible in our use of the vaccine, which has been really positive. So this is the task that we've got ahead of us. Our first 4 cohorts are to be vaccinated by the 15th of February, and you'll see those cohorts listed here. So residents in a care home for older adults and their carers, all those over 80 years of age, frontline health and social care workers, all those 75 years of age and over and 70 as well, and are clinically extremely vulnerable individuals. The list below, we don't yet have a time frame set out, but we will wait for that to come through, and we'll be absolutely committed to vaccinating as swiftly as possible. In terms of vaccination sites, and the geography for this evening is the county of Suffolk and North East Essex, which covers Colchester and Tendring councils, is that we have now 22 sites live. As little as just a week ago, we had a much fewer number. We had about 6 sites up and going, and now we've massively expanded our capacity so we can really accelerate forward. We are hoping to launch a large vaccination centre in Ipswich, in Gainsborough, very, very shortly, hopefully next week, which will really help the position. And there also, we've got hospital hubs at West Suffolk, Colchester and Ipswich, as well as James Paget, just over the border in Norfolk, that are vaccinating large numbers of health and social care staff to protect them too. Increasingly, it's going to be important that we consider pharmacy sites to support the programme, and there are pharmacies in Ipswich and Colchester and Lowestoft that have gone live, and I think as the programme develops, pharmacy will be a key plank of the programme. Obviously, there are lots of issues, and it's important that we hear about the issues and the questions that you've got this evening, so that we can work through them and improve on them. There have been lots of questions about the location of vaccination sites, and obviously people would like a site in every town and village if that was possible, but it's just impractical to do so. We haven't got the resources to do so, and there's strict criteria for the suitability of certain sites from a clinical perspective, so we've had to agree on those sites through the networks of GPs that are working together. In terms of communications, we've got our head of communications on the call, who I'm sure will answer questions about this slide, but we have an excellent website, or at least 2 excellent websites with information from the NHS that you can access, and there's lots of frequently asked questions and information there. we're holding this event tonight, and we're happy to do so again in the future. And we've got one provisionally booked for February too. So key messages before I hand over to you is that we are delivering the largest ever vaccination programme, and we thank everyone for their support, and we want to make this an absolute success. We now have a lot more capacity to deliver the programme, which is really positive, and we'll vaccinate all of our top 4 cohorts of people by mid-February and our care home residents by this Sunday. So I'm gonna stop there, and we can get into some questions and answers.
Thank you very much indeed, Ed. We've got lots of questions. We've got about 82 questions now that have come in. We're going to try and get through as many as we can this evening. So the first question then comes in from Danielle. My nan is in a home with extra care. So they are saying residents have to go to the hub to be vaccinated, but when she has broken her leg, getting her there will prove difficult. She's come this far. I really want her to be given the chance of this vaccine. So it sounds like a statement, but is there anything at all our panel could say in relation to Danielle's concern there about her nan?
Yeah, no, thanks very much. Danielle, it's a very important question, and I've been just looking through some of the other questions, so I'll perhaps give you just a slightly expanded answer to help with those other questions. And that is that anyone who cannot get to the surgery because they are, for example, housebound, and I think your nan would fit into that category because of a broken leg, they will be given the vaccine if they're in one of the eligible groups. So at this stage, if she was over 80 and she was housebound, she will get a vaccination. Because it's terribly important that some of the most vulnerable people who are actually housebound aren't missed off the list. But the reason it's not as straightforward as one might think is because it's only the AstraZeneca Oxford vaccine which can really be transported because it doesn't have to be stored at minus 70 degrees. And that's why that vaccine initially was just being used by hospitals with special freezers, really. So as the AstraZeneca vaccine becomes more widely available, then the home visits will start. So even though it may look as though those people who are housebound weren't being prioritized, it's not because doctors weren't concerned about getting a vaccine into them quickly. It's really because, well, as you know, the AstraZeneca vaccine was approved a few weeks after the Pfizer one, and supplies are obviously now coming out. So she will be on the list at your surgery or wherever they're planning to do it. So I won't go on much longer because of the number of questions, but in a nutshell, I think that's the answer. But therefore, the converse is true. And even if normally transport would be difficult for you, if you can get to a center to get vaccinated, you will obviously get it quicker if you're on one of the eligible groups. And that's why we would encourage people, if they can, with help, get somewhere, they'll get it quicker.
Thanks very much, Gino. A question here. Can you tell us what percentage of the over 80s you have vaccinated so far, and when will you be starting to invite the 70 pluses?
So the published data today said 36% for Suffolk and North East Essex. I'll ask Melanie to reply for Norfolk and Waveney. That data is a little behind the times, so we've moved on significantly since then. So when the next national data is published, you'll see an improvement for Suffolk and North East Essex. But Melanie, you may want to give your perspective.
Yes, we've been able to make a slightly earlier start in Norfolk and Waveney, and at the moment we are confident that we are approaching vaccinating 60% of our over 80s population as of the 19th of January. There's always inevitably going to be a lag and some discrepancies between the published data that was released that many of you have referred to in the Health Service Journal today and the league table. I think what's important to note is that this is a national vaccination programme, and this supply of vaccine is being directed nationally, and every area will catch up. It's true that the way the programme started was by a number of GP practices and primary care networks actually feeling that they were ready and confident to start and wanted to go early, and also that they had the appropriate sites. We had very clear criteria to meet set by NHS England to make sure sites were safe to deliver the Pfizer vaccine initially, and all of those factors were considered for areas in which they then selected how many sites they could stand up in the first wave. We're all now at the point, every area, where over a very rapid period, over 4 weeks, every area has started the number of primary care network sites. So Ed's mentioned a number for Ipswich and East Suffolk and West Suffolk and North East Essex, and for the Norfolk and Waveney population, there are a total of 21 sites that are now operating at maximum capacity. So every area will catch up. It's just that some happen to have earlier starts, and that's why there's such a discrepancy and difference in the figures that you're seeing. But we will get to everybody, and the key point is that we are every member of the population over 80. We will offer a vaccination by the end of January, and we're all planning for that goal and confident around that. And in addition, that we will vaccinate or offer a vaccine to every care home resident that's an older adult care home residence by just this Sunday, and we're making great progress on both of those two areas. But we will catch up, and vaccine supply, which many of you have raised questions about, is indeed being directed to areas so that they can catch up, so that everybody meets that goal that all the over 80s will be vaccinated by the end of January.
Thanks, Melanie. Some really important messages there for Melanie, so thank you for that. Why aren't Colchester GP surgeries being used for vaccination centres, and why don't we have a mass vaccination centre open in Colchester yet?
So some of this really goes around or adds to what Juno said earlier on. It's really around how the vaccine's been distributed. So it's a bit of a logistical challenge trying to coordinate the delivery of the Pfizer vaccine because of the need of specific fridges and a process around how quickly you have to use it after it thaws out. So when we were looking at this in Colchester, what we tried to do is maximise our opportunity to get the most people vaccinated in time, and so that's why we've opted to use 3 hubs. So one of the first hubs that came live was one in Clacton. We've now got one in the primary care centre in Colchester, and there's a new hub that's just come live in Harwich. So most of the surgeries now are donating their staff so that we're able to run a service at these 3 hubs, and that makes the best use of the available staff, because many of us are having to do it on our days off or on the weekends or now in evenings, because actually we're trying to keep the day job running at the same time. So that's how we're using the hubs. As time moves on and the Oxford vaccine starts to become more widely available, we will hopefully see more surgeries now being able to administer vaccines from the individual surgeries, and I'm hoping from as early as next week you should start to see more surgeries starting to deliver vaccine from their own sites. Us, for example, hopefully should be at Crefeld should be getting some Oxford vaccine from Monday, so we'll start to use our site from Monday to be able to deliver vaccine, and as the numbers go up, that'll start to get more and more be used more and more. The second question was around mass vaccination centres. I'm not sure I can answer that question. Ed might be able to answer that better than me in terms of when an Essex one's coming online, because I don't know the answer to that.
So we are working on a vaccination centre in the Colchester area. It's being organised nationally, and so any announcements will be made nationally, but we're absolutely committed to getting one open in North East Essex as soon as we can.
In Colchester, where I live, there seems to be only one place that is vaccinating Colchester Hospital in such a large area. Why is this?
The main reason is that we haven't got up to full capacity in terms of all the vaccination sites in East and West Suffolk and North East Essex until the last week. So we've been behind because we've had less capacity and therefore less supply of the vaccine. We've now got a lot more and we can really move forward. But in Colchester, as Hassan has described, there's a primary care centre there which is working as a significant hub. And we've also got the hospital working really well, and a pharmacy site, I believe too, that is now operational, and we hope a large vaccination centre through the national programme on the way. So there's good provision that's building in Colchester.
What is your view as to why the virus is being spread increasingly in shops and in stores?
Thank you. I think all I'll say is that in Suffolk we have a health protection board which is led by our Director of Public Health in Suffolk, and we look at different environments, retail, different places where we know that COVID is being transmitted and where we've had outbreaks. And one area that we have been focusing on recently has been supermarkets, and we've been really incredibly helped by our trading standards colleagues and our county council colleagues who have been visiting supermarkets and smaller retail shops to make sure that social distancing, masks are being worn, and all the guidance, the national guidance, is in place. But there have been some issues with smaller retail shops, but our Director of Public Health is certainly on top of that and is very aware and driving improvements in those areas.
What is the plan to fill empty available slots at short notice?
There are sometimes slots left at the end of the day, and I know that this vaccine is extremely precious and it's a privilege to be giving it. So I know that all my clinical colleagues across the patch share the view that no vaccine should be wasted. We all have a supply of frontline health workers, for example, that are ready to come down at short notice at the end of the clinics. And that's what we regularly do to use up any extra doses where people have not turned up in the day, for example. So the questioner can be rest assured that there aren't any wasted vaccines.
See, another question here. What are the criteria to which surgeries are working to call patients to have the vaccination?
So basically, we're prioritising the groups as per Ed's earlier presentation. So at the minute, it's over 80s that we're focusing on. So I know there's been media correspondence about starting to invite 70 pluses, but at the minute, what we're focusing on is trying to make sure we have vaccinated all the over 80s. So all surgeries should be contacting everyone in that range. Where it gets a bit technical is that we're using some technology, so we've been sending mass text messages, but for those people that don't have mobile phones, we've been having to use people physically phoning up, and if there's no phone number or we're not able to get through, they're having to write. So that's probably the reason why delay is coming about. But at the moment, we're focusing on over 80s and then working our way down the list, as it were.
Can an elderly person be vaccinated at home to protect them from the dangers of going outdoors?
Yes, they can be vaccinated. The protection thing is really a whole nother issue, but yes, they can be. But as Juno said earlier on, because of the way the vaccine has been delivered and our use of Pfizer vaccine as opposed to Oxford at the moment, we're focusing on people that can get to the test centres or surgeries, or focusing on areas where we've got large clusters such as care homes. But once we're able to, once the supply of Oxford vaccine starts to become more readily available, surgeries will start planning to vaccinate the housebound.
The term push model has been used on a couple of occasions this evening. Question here, what is a push model?
So this is where the supply is distributed centrally, and you indicate what you want, but it's not always, doesn't always arrive in the date you want or in the quantity you want. So a pull model is where you can actually specify exactly what you want and draw it down. So it's a much more efficient way of managing the supply chain.
What, if any, difference in terms of protection will there be between those who are vaccinated with the Pfizer vaccine and those who receive Oxford AstraZeneca vaccine and perhaps Moderna moving forward?
The published evidence suggests that the Moderna and the Pfizer vaccine, after having had 2 doses. And we know that the second dose now, the government has suggested that that's delayed till about 12 weeks. But as per the trial evidence, where it was given after 3 or 4 weeks, the second dose, the Pfizer vaccine was achieving 95%. The Oxford AstraZeneca is more interesting because when they used their usual regime of giving 1 dose, followed I think it was 4 weeks later by the second dose, they were getting about 60 odd%. However, there was one subgroup, because of there was some form of error with the batch, that they received a lower dose than the standard dose. So it was a different dosing regime. And they actually found that if they followed that regime, they were getting about 90% efficacy. So what they then did is, for the latter arms of the trial, they changed the dosing regime. I believe we're still waiting to hear what the published results are for that. So the simple answer is that the headline figure suggests that perhaps the AstraZeneca vaccine isn't as effective as the other 2, the Pfizer and Moderna. But remember, they're only looking at antibody levels, and and every doctor you speak to will tell you that immunity is more than just about antibody levels. There's also something called cell-mediated immunity using the T cells, and we know that that provides an important source of immunity, and it's much harder to check to see what sort of activation of the T cells there are. So if you just look at the antibody levels, one vaccine may seem better than another, but it doesn't mean to say the protection isn't as good overall. And there's lots of evidence, because every single one, as far as aware, of the tens of thousands of patients who were given the AstraZeneca vaccine, I don't think any of them were admitted to hospital, even those who caught COVID. In other words, it was relatively mild. And even if that's not 100% accurate, I know that none of them actually went into ITU and were seriously ill. So really, both vaccines, all the vaccines that are approved, are considered to be safe and effective. Only time will tell if there proves to be a difference in the future. But at the moment, any doctor would be happy to have either or even any of the 3 vaccines.
How are the rooms being ventilated with fresh air to stop the virus accumulating?
I know that in our own Lowestoft network site, we've paid a lot of attention to this, because these COVID vaccination clinics don't run exactly like a normal flu clinic where people can just all stand together in the queue and walk through. So that's why we're giving people timed appointments, and why every attention is being given to the flow. So we're on our own setup, and I'm sure most centres have replicated this. We're very conscious that people move through the building and out the other end where possible, and social distancing is observed. Everybody in the building will be wearing masks and gloves and attending to their hand hygiene, and where possible we keep the doors open and the windows open. I know some of the staff are wearing their coats at the weekend because there was a bit of a breeze, and that we've really made every effort that there's not queues, that the flow is maintained, and that people can be vaccinated safely, because we're very, very conscious of this. Most of the time that works well. Occasional times when, like in every situation, where there's small hitches, but we really pay a lot of attention to it, so they should feel reassured.
Will people be told which vaccine they get, for instance, Pfizer, Oxford, etc., and will their second dose be of the same vaccine?
I think it's yes is the answer. They'll be given a card when they arrive, which will have the name of the vaccine that they've been given on that day, I think the batch number recorded on it, and then when they're invited to have the second one, as far as we know, the intention from the national scheme is that they will definitely be given the second vaccine. We haven't heard anything different from that. So the same vaccine twice, and they'll know which one it is.
What are you doing about funding to help charity groups within the BAME community groups to do outreach work?
I think the answer is that our chief officer, that's Ed, who's been speaking, is very keen on making sure that funding is available for any to try and address any inequalities. We've also done a lot of work with various groups who are facing the BAME group. I mean, in Ipswich Commission for Racial Equality, Ipswich Community Media, and quite a lot of other groups that work extensively with these those in the BAME community. We've done quite a few talks, live events like this, and this event itself, we were hoping that there would be a percentage of BAME people on this, but obviously it's an open forum, and the questions that people have are legitimate from whichever community they come, as evidenced by the really great questions that have come today. So the answer is yes, we are absolutely trying to reduce inequalities by doing this and funding it where appropriate, but Ed will be able to give you a specific answer on the question itself.
Just to add that for Suffolk residents, there's a offer on the Suffolk County Council website which people can access. So I'm sure we could circulate with any notes as necessary.
Thanks, Ed.
Simon, I was just going to add from a Norfolk and Waveney point of view, it's Ben Hoxton here. So Norfolk and Waveney have been awarded some money through the Health Equality Partnership Fund, where we are looking at roles as trusted communicators to work with our vulnerable communities and produce a bit of a toolkit to look at kind of vaccine hesitancy, really, and about trying to look at what else is out there in the country to be able to show in terms of the evidence and the actual facts around the vaccine. So we are looking at how we can do that and roll that out through our voluntary sector colleagues. So I thought I would just add that from a Norfolk and Waveney point of view.
Seen some of the queues. Would it be more risky to actually go to get the vaccine? Happy staying at home?
We make sure that our vaccination sites are adhering to all the social distancing guidelines. There are sometimes queues outside. I was at one of our vaccination centres this week and people were queuing for a short period outside, but we have stewards outside who are making absolute sure that people are 2 metres apart. And then when you come through into the vaccination area, there is really strict adherence to the 2 metre guidelines, so you don't need to worry about that.
Can immunosuppressed patients have either vaccine?
There will be specific circumstances to discuss with the clinician, but broadly speaking, if patients are immunosuppressed, they can have the vaccines. One thing that we're being told to say, though, is that if you're immunosuppressed, there's a possibility that the vaccine might not give such a robust response as to a non-immunosuppressed person. So for that reason, you will get some immunity, but it might be slower or slightly less quick to develop, and less strong than another person. So the advice is to continue to do your social distancing and careful hygiene after you've had it, but it's still worth having. And there are very few contraindications to having the vaccine, but individual cases obviously will be discussed when they attend the vaccination site or on the phone beforehand when the appointment is made.
The first is that some people are worried that if you're immunosuppressed, that the vaccine might be dangerous to have, and the answer is no. HIV positive patients, for example, can be given the vaccine. Completely agree with Dr. Lucy's point that the issue really is, will the immunity be as good? No one really knows that.
How are we using volunteers as a system?
So we've had an overwhelming response from our communities to volunteer at vaccination sites, in the community transport and all different areas, and we're incredibly grateful to communities coming forward. Certainly the Suffolk GP Fed has been overwhelmed with people that want to help, and we're just processing the people that want to be volunteers, but we're incredibly grateful to the community for wanting to make sure that everybody gets vaccinated. So keep applying and we'll keep progressing through, because this vaccination programme is going to be with us for a few months yet. So the more volunteers we can get, the better.
And do you just want to plug how people can volunteer in terms of how they, if they were interested in volunteering, how they should approach the system?
Sure. So in Suffolk and North East Essex, they can apply through the ePut system, which is the Essex Partnership University Trust. If you go on their website, it's clear how you can apply. Suffolk GP Federation, they too have a website, and people can apply to be volunteer stewards on that website.
Just to add to what Lisa said, if people are interested in volunteering in the Waveney area of Suffolk, we would love to have your support. We've been overwhelmed with applications from volunteers who want to do marshalling jobs and very important roles like that, which is great, and also people who would like to return as a clinician to work as a vaccinator in any of the sites. Voluntary Norfolk and Community Action Suffolk are coordinating the volunteers for marshals, and there are multiple ways for returning clinicians to join, and maybe that's something we could share with the guests afterwards.
Well, because we've only got a few minutes left, just to address the number of people have put in some clinical questions, and as you quite rightly say, there isn't enough time to answer them. But I think there's a little bit of information I could give that would probably cover a few concerns that people have. So if I could just have a minute on that time. The first is those people who are clinically extremely vulnerable. They are very concerned that they may not be having their jabs and aren't being prioritized. The second group are those people who are considered to have underlying conditions who are vulnerable. There's been a lot of confusion about the difference between extremely vulnerable and vulnerable. So let me just quickly say that if you're clinically extremely vulnerable, you would have had a shielding letter from the government, either in the first or the second wave of those letters. If you've had that, you are clinically extremely vulnerable, but your level of risk is that of a 70-year-old and above. So you will be called through with those people who are 70 and above. The greatest risk, funnily enough, is to those who are 80 and above, and people who are clinically extremely vulnerable, unless they also happen to be over 80, are actually have a lower level of risk than the over 80s. The other group are those who have underlying health conditions. You wouldn't have received a letter because you're not extremely vulnerable, but you would normally have a flu jab. And these are things like chronic liver disease, kidney disease, diabetes, etc., etc. So there's lots of information on the government website, but just to say your risk is a little lower than that of a 65-year-old, and therefore you will be called through after the 65-year-olds are called through. Just hope that just addresses some of those questions, that you are at risk, but the age is really the ultimate risk factor here.
Yeah, thank you, Simon, for comparing, and more importantly, thank you for everyone on the panel for the contributions and all the questions and input we've had from the communities. It's greatly appreciated, and we all learn a lot doing these sessions. So if they're useful, we'll obviously do more in the future. And I think it's really important that we talk honestly and we keep you in the picture of how we're progressing. So thank you very much.